movements which will be required every minute, every second, every hours in anatomy. Flexion, extension, adduction, abduction, circumflexion, rotation, etc. This term is very essential and should be clear to you. First is already you have got the idea about the plane. Now going to the term flexion and extension. Flexion and extension. This is an angle. You know, in mathematics, this is angle. We call it the angle. In loosely, again I am saying there are exceptions, but in loosely, when there is and in anatomical term, suppose it is another bone and it is another bone and it is a joint. For example, this. So, in the joint there is an angle. If the angles gets reduced, minus, become this type. We call it flexion. Loosely, we call it flexion. If the angle is increased, whatever is the position of the joint, if the angle is increased in the joint, we call it extension, normally. So, it is one arm, it is another arm of the angles. If it is so here it is, the angle is 180 degree. So, now the angle is 120 degree. So, it is an flexion. It is 120 degree. Now, it becomes 60 degree. It is flexion. Angle is reduced. And from 60 degree to 120 degree, extension. Angle is increased. So, normally, in case of a inferior extremity, this is the angle looking backside. So, it is the flexion, it is the extension. It is the flexion, it is the extension. In case of a neck, it is the flexion, angle is reduced, it is the extension. Right? In case of a shoulder joint, here the angle is like that. So, it is the flexion, this is the extension. In this joint, it is the flexion, it is the extension. It is the flexion, it is the extension. In this joint, the plane is like that, slightly oblique. So, flexion is that, this is the extension. Right? So, as these two surfaces, here and here, in flexion approximate each other. Approximate মানে কি? Getting close together. কাছাকাছি হয়ে যাচ্ছে. So we call this surface anterior surface, or better term, or flexor surface. As in flexion, they are coming close together to almost touching. So this surface, in case of a superior extremity only, we call it flexor surface of the superior extremity. So this surface is the flexor surface. In case of an inferior extremity, not this surface. This is the flexor surface, because these surface approximate with each other. Right? It is usually applicable, this flexor and extensor, in the extremities only. So, in other words, we can say that flexion is a process by which two flexor surfaces approximates with each other. Approximate means getting close together. So flexion is a process where two flexure surface, this is the one surface, this is the another surface. In between it is the angle, right? The joint. So two flexure surface approximate each other. Here, this is the flexure, this is the flexure, approximate each other. And opposing surface is the extensor surface. So this is the extensor surface, this is the extensor surface. So what is in the case of a noun? So there are two definitions of flexion, either the angle is reduced or two flexure surface approximate each other. Now the question comes, so flexion and extension, no. Now what's happened here? Here, look, do you yourself. Here in ankle joint, angle is reduced. So it should be flexion, right? In here, in ankle joint, angle is increased. So it would be a extension. Normally, should have to be. But the question is that it follows one law but not maintains the other theorem. What is that? Flexion is the apposition of two flexure surface. And I have already told you, this is the flexure surface. And in sole, the lower surface, sole, is the flexure surface. তাহলে তো হলো না। এইখানে যখন করছি, এইটা হচ্ছে extensor surface. In foot, this is the extensor surface. এখানটায় দেখাই। This is the extensor surface. And this is the extensor surface. Though the angle is reduced, but two extensor surface comes close together. So it should not be a extensor, flexion. Angle is reduced, no doubt. But here I am already told you in case of a foot, it is the extensor surface, this is the extensor surface. Foote, etate noy. So we call it, though it is a flexion as the angle is reduced, but the two extensor surface comes together. So we give a special name here in case of a foot only. We call it dorsiflexion. And lower down we call it plantiflexion. Extensor termta omit kore diyechi ekhane. Though angle is increased, as two flexure surface come close together, we call it plantiflexion. So in case of a foot only, it is the dorsiflexion, it is the plantiflexion. It is the dorsiflexion, it is the plantiflexion. Dorsiflexion can be regarded as an extension. আমরা বলি না, আমরা dorsiflexion, plantiflexion. Both are regarded as a flexion. এই যে dorsiflexion, plantar flexion. There is another term in a midline structure. As I have told you, this is the midline, this is the lateral side, so it is the lateral flexion. This is the lateral flexion. It is a normal flexion, midline flexion, flexion of the neck. And when you do this, we call it lateral flexion. Right lateral flexion, left lateral flexion. Now another term, adduction and abduction. It is more or less easy. It is the midline of the body. In case of extremity, when any movement brings the extremity or the part towards the midline, we call it adduction. And any movement would move the extremity away from the midline, we call it abduction. So, this is the adduction in anatomical position. Yeah. This is the abduction. This is the adduction going towards the midline. This is the abduction going away from the midline. But in case of a fingers, there is a certain difference. In finger, in case of a palm, superior extremity, with this middle finger or third finger, finger is named in this fashion: 1, 2, 3, 4, 5. It is the thumb, it is the index finger, it is the middle finger, it is the ring finger, it is the little finger. Here we regarded, in case of a palm, the middle finger or third finger is the axis finger or midline finger. So, movement of finger towards this third finger or middle finger is adduction. Away from this, abduction. So, this is adduction, this is abduction. Opposite is in there. Not this is the adduction. As it moves towards the middle finger, this is the adduction and this is the abduction. This is the adduction, this is the abduction. This is the adduction, this is the abduction. So, what is this movement? A finger, adduction or abduction? Adduction. Eta a finger, what is it? Abduction. এখানে এই মিডলাইনের সাথে যোগ নেই। আর in case of a foot, second finger is the axis finger. Any movement towards the second finger, other finger movement is the adduction, and away from it is the abduction. Right? In case of a shoulder joint, it is the adduction and this is the abduction. Plane এর সাথে it is away from the midline. Abduction. It is, and when you raised our whole superior extremity above the head, we call it overhead abduction. Overhead abduction. Overhead abduction. একটু তাড়াতাড়ি যাচ্ছি কারণ অনেক বাকি রয়ে গেছে। তাহলে এইটা হচ্ছে অ্যাডাকশন, এটা অ্যাবডাকশন। পায়ের ক্ষেত্রেও তাই, অ্যাডাকশন অ্যাবডাকশন। আর ফিঙ্গারের ক্ষেত্রে এটা হচ্ছে ফ্লেকশন, এটা হচ্ছে এক্সটেনশন। ফ্লেকশন, এক্সটেনশন। থাম্বের ক্ষেত্রে একটু ডিফারেন্স আছে, পরে আমি বলবো। আরেকটা থাম্বের ক্ষেত্রে, in case of a thumb there is a peculiar movement in the human being only, not found in the apes, etc. We can touch the pulp of the thumb with the pulp of the other fingers. No animals can do this. This is a unique property of human being, and this movement we call it opposition. 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 Thumb. Thumber ক্ষেত্রে, only in case of a thumb, we touch the other finger with the pulp of thumb. We call it the opposition of the thumb. And when you go back, reposition. Next is the rotation. When we rotate towards the midline, towards the axis of the body or counterclockwise, we call it medial rotation. And this is the lateral rotation. Look, medial rotation, lateral rotation. This is the medial rotation, this is the lateral rotation. This is the medial rotation, this is the lateral rotation. In case of hip joint, this is the medial rotation, this is the lateral rotation. Laterally rotate korche. Lateral this side, medial midline. So when it moves medially, medial rotation. Rotation means this movement. And when it moves, it is known as the lateral rotation. আরেকটা মুভমেন্ট রয়েছে, very important movement In case of a superior extremity, one, and inferior extremity, another. Pronation and supination. Both are essential. By pronation and supination, it is the fundamental movement. We can take food. When this movement, look, this medially rotated, this movement by which we can take food, look, is a pronation. And opposing movement, screw driving movement, screw tightening movement, এই যে screw tight করছি, it is known as the supination. In pronation, look, radius, normally it is remain parallel radius and it is the ulna. They remain parallel. When we pronate, the radius moves crossing the ulna in this fashion. So this is the pronation, this is the supination. So in anatomical position, our our forearm remain in supinated position. In anatomical position, one of the criteria of the anatomical position, the forearm will be supinated. This is in wrist joint, it will be extended. It is the extension, neutral position, and it is the flexion. In case of a inferior extremity, there are, like pronation and supination, there are two terms, inversion and eversion. Inversion মানে হচ্ছে এই, so that your soul looks towards the midline, and eversion হচ্ছে এই, ভালো করে লক্ষ্য রাখো, ইনভার্সন eversion, কাউকে পা দেখা, সামনে একজন দাঁড়িয়ে আছে, ওকে পা দেখাচ্ছি, eversion, আর নিজেকে পা দেখাচ্ছি, ইনভার্সন. So inversion, eversion, very important movement, especially walking on an uneven surface, walking in a hill, uneven surface. This inversion and eversion is very important, and pronation and supination is very important in food taking. It is the fundamental movement. Next, especially in shoulder hip joint and also in thumb joint, first carpometacarpal joint, there is a movement, we call it circumduction. We call it circumduction, where all the movements are combined together, flexion, extension, adduction, abduction and rotation. বল করার সময়, so that if it is a apex, if it is a base, base forms a circle, base of the circle, একটা কোণ যদি তৈরি করে, so it forms a base of the cone. All the movements are combined, flexion, extension, adduction, abduction, and also rotation. So this is known as the circumduction. In case of a shoulder joint, this is known as the circumduction. Just have an idea, because after 2 weeks you will go into dissection, it will be required just for practical knowledge. Suppose you are doing superior extremity. So in the cadaver, we first open this area and make an incision here on the skin only. Then by adding a forceps and a scissor, gradually you strip off the skin one on either side. If you cut the skin and strip the skin one on either side and hold it in by means of a steel retractor, which keeps the skin on either side, they will find, just dip to the skin, just to cut the skin, you will find a layer like that. এই জায়গাটায়, just skinner, just deep to the skin with a few locule of fat, like a wool, like a cotton thread, seam with a yellowish, if it's a body is fresh, yellowish fat locules are there. We call it superficial fascia. We call it superficial fascia, a connective tissue layer, loose connective tissue containing some fiber, some cells, some ground substance, etc. Make a woolly layer just underneath it. We call it superficial fascia. Except in all over body, this superficial fascia is present. If you cut the skin, remove, if you carefully strip off the skin, you will find the superficial fascia. Then we cut the superficial fascia and also retract. Retract মানে কি দুপাশে সরিয়ে দাও. Move this layer one on either side. Then you will find a transparent membrane-like fascia. It is a transparent. Here it is opaque, white, but it is a transparent, like a plastic, like a cellophane paper, a fascia. Sometimes it is very tough. খুব শক্ত থাকে অনেক জায়গায়. We call it deep fascia. We call it deep fascia. Present all over the body except in abdomen and in face. থাকে না, কারণ আছে, কারণ abdomen, if the deep fascia is present in abdomen, deep fascia is very tough and prevent bulging of the abdomen, so that stomach cannot bulge properly, intestine cannot move properly. If we take overeating, it cannot bulge, so we will be suffer. So in abdomen, deep fascia is absent. In face also, for facial expression, if deep fascia is present, we cannot give the facial expression. The facial expression, if the deep fascia is present in the face, it will not be possible. So deep fascia is absent in the face and in the abdomen. Otherwise, the deep fascia is present, and sometimes it is very specialized and become very thick to protect some underlying structure. For example, parotid gland, the deep fascia is very thick to form a parotid fascia. This is the deep fascia. Look, transparent deep fascia here, which protect and binds the underlying structure. We call it fascia lata. If we cut this deep fascia, then you will find the muscles. Then the proper dissection, vessel, nerve, and in the superficial fascia also, there are small branches of the arteries, veins, nerves, etc. are also there. Right? So with this introduction, we will go to the dissection classes. Next পাল্টে দাও, একদম ব্যাক করে আরেকটা, এই দাঁড়াও একটুখানি। আচ্ছা আরো দুটো টার্ম বলে দেই। This is a muscle of the abdomen. Muscle of the abdomen, right? Muscles of the abdomen. Here, external oblique, internal oblique, and here the muscle ends, and you look like a deep fascia, a tough elastic membrane is there. Flattened connective tissue layer, very thick. We call it aponeurosis. We call it aponeurosis. This is a muscle. Muscle may be attached. Muscle, I have told in the last day, in clavicle, muscle is attached to the bone. Right? Muscle is attached to the bone. Suppose it is the bone. The muscle may be attached to the bone in different ways. This is a muscle. Muscle may be attached directly to the bone. Directly. directly attached to the bone. For example, kalke I have shown you subclavius muscle, directly attached to the bone. Muscle may be attached to the bone by means of a tough ribbon-like structure. We call it tendon. Very tough. We call it tendon. Elastic. Tough fibrous tissue made up of a fibrous tissue. Collagen fibers are there. Very tough. We call it tendon. And muscle may be attached by a flat membrane. We call it aponeurosis. We call it aponeurosis. Look this. Right? তাহলে এই আইডিয়াটা একটু করতে হবে। This is the nerves. And in dissection, how to differentiate nerves, vessels, etc. The nerves are usually whitish or darkish white in color. And it is a thick structure. No lumen. Lumen mane ki? Yes, very good. If it is a tube, it is a hollow thing, we call it lumen. We call it lumen. And we call it this thing, we call it wall. In nerve there is a no lumen. It is like a cord. Sutor corder mo, like a cord. If we feel it, you feel like a cord. No lumen. If there is a lumen, you can do this and find it is like that. So if the lumen is present, either it is an artery or a vein. Artery wall is very thick, slightly pinkish white in color, and venous is slightly bluish black in color. And wall is very thin, so that by which you can identify this structure. Hey, back. Now today, general anatomy starts by bone. You have already got idea of bone, so I not want to go into details. I mainly focus on the questions that will be come in your theoretical examination. Just for recapitulation, I will tell some already, possibly in the first class, you have got idea the classification of bone, long bone, short bone. হয়ে গেছে তো সবার? হ্যাঁ? Long bone, short bone, flat bone, miniature long bones, sesamoid bone. সুতরাং I don't want to repeat it, otherwise time will be consumed and your so bone is a specialized, highly vascular, living, constantly changing, mineralized connective tissue. Already you know, we have got 4 basic type of tissues: epithelial tissue, connective tissue, muscular tissue, and nervous tissue. Right? Histology first class e bolechi. There are 4 types of tissue. All the tissues, all our body formed by these 4 types of tissues: epithelial tissue, connective tissue, muscular tissue, and nervous tissue. And connective tissue has got, again there are so many sub-classification. loose alveolar connective tissue, dense connective tissue, etc. And some are special, adipose tissue, all are connective tissue. They are specialized. Similarly, bone is a specialized connective tissue. What is the peculiarity of the bone? It is hard, it is a hard thing. Mainly superficial fascia, deep fascia, all are connective tissue. Adipose tissue, fat royeche, all are connective tissue, but they are not hard. Two things are more or less very firm or hard is the cartilage and the bones. Both are connective tissues, specialized. Cartilage is specialized one way, bone is specialized in another way. What is a bone? Is a living thing. Here the bone is dead because it is cadaver. But actually, in your body, in our body, body is highly living. It is constantly forming, reforming, destroying, everything going on. Highly living thing. So, another peculiarity of the bone is a calcified. Calcium salts are deposited there to make it hard. And it also so it's a connective tissue. And in our body, adult bone, about 206 bones are there. And again already I am told we can classify any groups of persons or groups of things in different way. So we can classify, there are so many bones, so many different looks of bone. Some are long, some are short, some are hard, some are tough, some are flat. So we can classify in different way. First classification, already you know, according to the shape, long bone, short bone, long bone, miniature long bone, then short bone, flat bone, pneumatic bone, accessory bones, etc. এগুলি আমি আর রিপিট করতে চাইছি না, শুধু ইম্পর্টেন্ট একটা বোন রয়েছে সেসাময়েড বোন, এটা সম্বন্ধে একটু বলবো। কেউ বলবে একটু? আমি তো ততক্ষণে করছি। হোয়াট ইজ দ্য ক্রাইটেরিয়া অফ এ লং বোন? একজন ক্রাইটেরিয়া অফ এ লং বোন, নাম্বার 1, 2, অ্যাটলিস্ট 4, 4টে বলো বলো। ফার্স্ট বলবে ইট ইজ এ লেন্থ ইজ বেটার দেন ব্রেথ। ফার্স্ট নর্মাল লেম্যানস টার্ম, সাধারণ স্টুডেন্টরাও যেটা বলবে, বিএবিএসসি স্টুডেন্ট যেটা বলবে সেটা বলবে, the length is greater than breadth. Then it has got a shaft and 2 ends. Bello আর মাইক না হলে বুঝতে পারছি না। It has got, শুনতে পাচ্ছি না। Oh, it bears weight. Very good. It bears weight. Weight is beared by the long bone. আর এই এখানে আসো, এখানে চলে এসো। আরে আজ বাদে কাল এটা নাও, মেডিসিনের টিচার হবে তো, এমডি মেডিসিন করে টিচার হবে তো, অ্যানাটমি বলছি না, বলো। কোথায় গেল? হ্যাঁ,
the typical long bone, they are the one which are vertically placed, except the one which is the clavicle.
Very good.
A modified long bone which is vertically placed. No, sir, horizontally placed.
typical long bone is longitudinally or vertically placed, and modified long bone clavicle is horizontally placed.
Yes, sir.
Normally long bones are longitudinally placed. Then it bears weight.
Yes, sir.
It has got a shaft and 2 ends, usually 2 ends.
Yes, sir.
2 ends, and the shaft is called diaphysis and 2 ends are called epiphysis, and it is cartilaginous in ossification. এটা বলতেই হবে। Enchondral ossification. আমি clearly বলেছি what is enchondral, what is membranous. Very good job, very good, thank you. তাহলে এই ক্রাইটেরিয়া থাকলেই আমরা লং বোন বলবো, and it is usually deeply placed surrounded by a muscle. হ্যাঁ, yes, usually one primary center of ossification, usually. এক্সেপশন হলে ক্ল্যাভিকল, সেটা হচ্ছে মডিফাইড লং বোন, ক্ল্যাভিকল বলে দিয়েছি। সুতরাং এটা গেল লং বোন। শর্ট বোন, শর্ট 6 feet, usually trapezoid, cuneiform in structure and 6 surface থাকে। ফ্ল্যাট বোন is looks flat, ডিটেইলিং দরকার নেই। যেটা জানতে হবে সেসাময়েড বোন। হ্যাঁ, ইয়েস, ওই ডিপলি প্লেসড বলেছি। সো ভেরি গুড, তাহলে আস্তে আস্তে হয়ে যাচ্ছে তোমাদের। বললাম না ফার্স্ট ক্লাসে মনে হবে, in the first class you will think that will be no, we cannot cope up with the anatomy. After 1 month anatomy will be as easy like anything. Even without me you can go through, by the beautiful books are here, you can go through, but you have to read properly and with your instinct to understand. Okay, all right, it is a time consuming. So I am going to the most important bone in our body, the sesamoid bone. Sesamoid bone is the particular bone, a seed-like bone. The word coming from a seed, Arabic seed, sesam means seed. এই যে ফল থাকে, ফ্রুট, ফ্রুটের মধ্যে সিড থাকে, তাই তো? The seeds are present within the fruit. Similarly, sesamoid bone usually present within the tendon of a few muscles. Sesamoid bone present within, bhetore, intra, not inter, intra to the tendon of the muscles. Best examples are two. One is patella, another is here, pisiform bone. There are other bones also in the flexor hallucis brevis, flexor pollicis longus. Two other bones are also present. In the lateral head of gastrocnemius, there is another bone is there. Of which the ideal is here. It is present within the tendon of the quadriceps femoris or ligament. What is that? Here in the thigh, in the extensor region, here on the anterior surface, there are 4 muscles are present. Rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. Name of the 4 muscles. You have heard in football there is a quadriceps pull. These 4 muscles in the leg, rectus femoris, vastus medialis, vastus lateralis and inside vastus intermedius. These 4 muscles in the lower part, they join, all these 4 muscles join together. No, sorry, এখানে নয়. They are attached. Medialis and lateralis are attached. Ultimately, all these 4 muscles, they form a tendon. They form a tendon here and attached to the part of the tibia bone. So these patella is remain inside or within the tendon of this quadriceps femoris. Similarly, here is a muscle known as the flexor carpi ulnaris. Here there is a tendon and there is a small nodule-like bone is situated here, which is present within the tendon of the flexor carpi ulnaris. Within the tendon of the, this is the flexor carpi ulnaris, it becomes tendon and it is the bone. We call it pisiform bone. So, first criteria of the sesamoid bone, it is a seed-like small bone situated within the tendon of a muscle. In bones, especially long bone, when you go to the histology class, you will find long bone in the inside. There is an cavity we call medullary cavity containing marrow in adult. Yellow marrow in case of a adult, in children it is a red marrow containing blood cells and can produce blood. And this area, it is a bone tissue. It is a bone, hard ivory like, हाथीर दांतेर मतो, हाथी का दांत का माफिक, hard ivory like, though, but it is not like a steel because it is highly porous. If you see under microscope or properly, this hard ivory like bone has got a canal, small canal, shuru canal ache. সূক্ষ্ম সরু ক্যানেল আছে, নিডলের মতো ঢুকে যেতে পারে, Haversian canal. And surrounding this canal, there is a bones or tissue are present. Bone tissues are present. খুব quickly বলছি, and it will be as easy like anything when you go to the histology of bone. We call it the Haversian canal, or the whole system, we call it the Haversian system. So, in long bone, there is an Haversian system. And there is another type of bone, which is like that, spongy in character, like a plates, needles, like are not disposed like a ivory. They are disposed like this pattern. একটা প্যাটার্ন হচ্ছে এইরকম, more or less hard, though not solid, ভেতরে ছোট ছোট ফুটো রয়েছে, small holes are there, small canals are there, but still it looks like that. This is we call compact bone. We call it compact bone. And another type of bone, especially present in the end of the bone, and also in the flat bone. The bones are disposed like that. In between there is a gap in which marrows are situated. Here bone marrow is situated in a canal. But here the marrow are situated in between the bone plates. These are the plates of bone. Bone is look like that, like a sponge. So we call it spongy bone. We call it spongy bone. We call it spongy bone. Come on. But they don't contain the Haversian system. সেরকম patella, though a compact bone, but it usually does not have Haversian system. It একটা important criteria. Patella has got no Haversian system. Number 2, another important criteria of the bone, আমি বলেছিলাম, it is covered by a membrane. We call it periosteum. Periosteum. But in patella, there is no periosteum. There is no periosteum. তাহলে কি হলো? It is present within the tendon, no Haversian system, no periosteum. Patella also ossifies by center of ossification, by one center. But they appear after birth, not before birth. So, patella bole kichu noy, all sesamoid bone. So, all these things are characteristic of sesamoid bone, and ideal example is the patella, and another example is the pisiform bone, a small sesamoid bone present in the lateral head of gastrocnemius, a small bone present in the foot here, flexure pollicis brevis, etc. আরো রয়েছে, তাকে আমরা বলি sesamoid bone. What is the function? কেন দেয়? Suppose কেউ বলতে পারবে, if we remove a patella from some one person, whether he or she can walk, আমরা প্যাটেলা বাদ দিয়ে দিলাম, কি হাঁটতে পারবে? হ্যাঁ, হাঁটতে পারবে, নর্মালি হাঁটতে পারবে। In flat surface there is a no difficulty. In flat surface বুঝতেই পারবে ওর প্যাটেলা আছে কিনা, there is a whether patella is absent. But in uneven surface, walking uphill, উঠতে যাচ্ছে, there will be difficulty. So patella is not essential, but in specialized movement it is essential. Flat surfaces there is a no difficulty, normal লাগবে। But when this type, we cannot properly, must take some assistant to go inside. What is the function of the sesamoid bone, especially patella? It usually lessens the friction of the tendon. Number two, it alters the pull. Suppose the quadriceps femoris acts, the pull will be like that, but it simply alters the line of pull of the action of the quadriceps femoris to help in walking. Just ওইটুকুনি, কেমন? বাস, কেন আমি পড়ালাম এটা? Sesamoid bone may come as a short note. হ্যাঁ বলো, হ্যাঁ কোনটা? সেকেন্ড ওয়ান বলতে গেলে অনেক বলতে হয়, কিউ অ্যাঙ্গেল আছে, হোয়াট ইজ এ কিউ অ্যাঙ্গেল আছে, এখন নয়, এটা পরে পড়াবো। ধরো আমি বলে দিচ্ছি, এভাবে বোঝাই। যারা আক্তার স্যার ফোন করেছে কেন? This is the patella. Suppose there is a no patella. This is the quadriceps muscle, this is the tendon. If there is an pull, they act, it will be act. When this act, the tibia will be, tibia টাতে নেই এখানে, tibia, suppose it is a tibia, lower bone. Actually here it is a here, but actually it is a tibia. ধরে নাও, lower bone. So if no patella is present, the pull of line deviates in this fashion. পাটা এরকম ছড়ে যেত। আর প্যাটেলা থাকার জন্য it makes this straight. বুঝতে পারছো? It altered the line of pull. নর্মাল যদি প্যাটেলা না থাকতো তাহলে আমরা ডিভিয়েটেড হয়ে যেত, হাতটা এরকম হয়ে যেত, কিন্তু প্যাটেলা থাকার জন্য আমরা এরকম হাঁটতে পারছি। Alter the line of pull towards the midline. যে অ্যাঙ্গেল দিয়ে করে, লাইন অফ পুলটাকে করে, তাকে কিউ অ্যাঙ্গেল বলে, ও ডিটেল দরকার নেই। তাহলে এইটা শিখলাম sesamoid bone. Why I make it so long? Because it often comes as a short note.